Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is August 28th, 2020. As always, we start with our COVID-19 statistics. Worldwide, we have nearly 25 million cases and over 838,000 deaths. In the United States, we have over 6 million cases and over 185,000 deaths. So today, we need to talk about aerosols. We've mentioned in the past few weeks that it's still not completely clear how big a part in the spread of COVID-19 aerosols play. That's still the case, we don't know for sure, but the evidence is growing quite a bit that shows that aerosols play an important part, a large part, in the spread of COVID-19. I've provided a number of links below the video that go into more detail. You can go ahead and check those out if you'd like. But right now I want to focus on what this means for us. One big thing is that the 6-foot rule, where we need to stay at least 6 feet away from people, that's a little bit outdated now. It's still definitely a bare minimum because it's still good for droplets. Droplets from sneezing or coughing will produce droplets, and the 6-foot rule still works pretty well for that. But when you've got aerosols, which can also be released through breathing, speaking, coughing, sneezing, all of those. When you have those aerosols, they can go much further and they can also stay in the air for much longer. The droplets tend to drop out of the air really quickly, within minutes usually, or even seconds. So many organizations have created different charts, graphs, acronyms even, to help us determine what situations and places are safe versus which ones are not. You've probably seen some on social media. Generally speaking, however, the more protections you take or protective measures you take, the safer you'll be. So what are those protective measures? Well, they include many of the things we've talked about in the past and a few that we haven't focused on as much either. So, first off, washing hands, wearing a face mask, staying a safe distance away from others, at least 6 feet, avoiding large gatherings, and being outside if gatherings are necessary. All those things are good steps to take in order to avoid COVID-19. As we talked about 2 weeks ago, aerosols can fill confined spaces quickly and stay in the space for quite a while. Even though it's not exactly the same, it may help to think of aerosols as smoke. If someone is smoking inside of a house, pretty soon everyone in the house can smell it and even see it. The smoke just kind of lingers, it builds up. If someone is smoking outside, only those close to that person are affected because the smoke gets diluted by the air, especially if there's a breeze. Wearing a mask could help keep some of that smoke, or in our case a virus, away. And as we've talked about before, even though masks aren't perfect at keeping aerosols out, they do help some. It's been shown that the less virus you get, the weaker, first off, the less chance you're going to get sick at all, and the weaker your symptoms are going to be, the milder they'll be. So, to take the smoke analogy a little further, if the person smoking would put on a mask before breathing it out, then much of that smoke would stay, inside the mask. Sure, there would be a little bit seeping out, and that's the same with COVID-19. Some of those aerosols would still get out, but it would be a lot less. And once again, less means, a better chance for you not to get sick or to have milder symptoms. Also, being outside doesn't mean you're automatically safe. If you're outside but you're in a big group, or if you're standing right next to someone that has COVID-19, you're still going to be at a higher risk. Same thing, with the smokers. If you're standing right next to someone smoking, you're still going to smell it. If you're in a group of smokers, there's a lot higher chance you're going to smell it or even feel the smoke. So same thing with COVID-19. That's why it's not just about getting outside, which is a great idea, but it's not enough by itself. Get outside and social distance. Don't have huge gatherings. So to summarize, the best way to stay safe is to stay away from everyone. That's not actually doable for most people. Most people have jobs or have to go to school or something along those lines. Also, many people rebel against lockdowns and stay-at-home orders. We saw that earlier on this year. So the option of staying at home and staying away from everybody is best saved for those that have that are a confirmed case. They should quarantine themselves just so they don't spread it to other people. The next best way to stay safe from COVID-19 and to stop it from spreading is, with feeling now, wash your hands, watch your distance, staying at least 6 feet apart, wear a face mask, keep gathering small, and gather outside if you absolutely have to gather. We've been saying it time and time again for weeks now, probably months. It's basically the same stuff. So speaking of limiting gatherings, many new cases and at least one death have been reported due to 2 separate gatherings. One was a wedding in Maine. That's where the death was reported, as well as many, I think over 50 cases of coronavirus. And then also the Sturgis motorcycle rally in South Dakota. The rally is especially concerning to public health officials because people come to that rally from all over the country and Canada, possibly even other countries, and those people now could have gotten infected there, and they have gone back to their own communities now, and they could be spreading it. There have already been a number of cases that have been tracked that way. There's probably a lot more that have not been found yet. Another big bit of news this week is that the CDC changed its recommendations on testing. They said that it's no longer necessary to test those who come in contact with a confirmed case but show no symptoms. This goes against what the CDC has been saying previously, and a lot of scientists kind of got in an uproar about this. The reasoning behind that, or behind the uproar, is we need more testing. We just flat out need more testing. Without the testing, we're not going to be able to do the tracing and everything else that helps us understand this virus better. So apparently, from different news reports, it looks like the CDC was pressured by the White House Coronavirus Task Force at a time when Dr. Fauci was not available due to surgery. And they basically pressured the CDC, and that's when the CDC decided to make this announcement. They've since kind of walked back a little bit. They still haven't fully changed back to recommending testing, but they have said that testing is important. The CDC also released guidelines to warn store employees and anyone else not to argue with anti-maskers. The risk of violence is just too high. It really is actually pretty sad that these guidelines even have to be released. You would think that something like wearing a mask, which is something very simple to do, shows that you care about those around you, that you don't want to give them the virus. You would think that something like that would not be a subject for debate, but it's become political, and it really is contentious. And so even though the CDC still recommends face masks, still recommends that stores try to enforce their policy, they say if someone looks like they're going to get violent or anything, don't push it. It's not worth it. The FDA, the Food and Drug Administration, has issued a warning about hand sanitizer that is being sold in containers that look like food or drink containers. Specifically, they mentioned hand sanitizer being sold in bottles that look like just plain water bottles, and also hand sanitizer sold in those little pouches that come like with applesauce or other squished fruits, usually for children. And this is definitely dangerous, especially the ones for the children, because children typically don't know any better. They don't know how to read the labels a lot of times, but even adults could mistake this for something edible or drinkable. And hand sanitizer is not safe to eat or drink. People have died trying to do that. So yeah, definitely not a good idea. Try and stay away from those kind of hand sanitizers. If you see them in the store, do not purchase them. We don't want to encourage packaging like that. It's just confusing and dangerous. Researchers in Germany have found that moderate to intense exercise while infected with COVID-19 can cause inflammation of the heart, which can result in heart failure. Other studies have also shown that someone who is infected with COVID-19 but not currently showing symptoms can start to show symptoms after moderate or intense exercise. They expect that the reason for that is that the extra stress on the body from the exercise is probably causing our immune system to have to kick it up a notch, using more of the body's energy and everything. And so it's not able to keep up, and it just comes out as symptoms being shown. Currently, many doctors recommend that if you are sick with COVID-19, or even believe you are sick with COVID-19, that you stop exercising for at least 2 weeks, since that's the typical duration of COVID-19, though it can last much longer. But stop exercising for at least 2 weeks, and then ease back into exercising after that period of time. And that does include other strenuous activities, not just plain exercising, but any other strenuous activities that you may be doing. Researchers in Hong Kong have verified a case where a patient who had COVID-19 approximately 4 months ago has now been reinfected. This time around, the patient did not have any symptoms, though. But they were able to do a test and verify that it is a slightly different strain, so it's not just picking something up from the previous infection. This is actually not surprising for scientists. Most scientists around the world that are studying COVID-19 had expected something like this for quite a while. We've expected that COVID-19, because the immune system doesn't keep the antibodies around for very long. We expected that we could get it again, but because of the other components of the immune system still keeping a little bit there, knowledge of the disease, we expected that it would be more mild the second time around, and it does seem that that's the case. This is just a single case that we've been able to verify, so it's still not completely certain, but it does go with what's expected. One thing about that, though, is the most dangerous part of that is that since the second time around, when you're infected, you're asymptomatic, you could still pass it along without knowing it. So we need to be careful. Sweden is in the news again for claiming to have achieved herd immunity. The thing is, their numbers, cases and death numbers definitely show that they have not achieved herd immunity. We talked a bit about Anders Tegnell last week. And we've talked about Sweden's, their approach to COVID-19, basically just don't do anything. Basically, herd immunity is something dangerous to strive for if we don't have a vaccine. Once we have a vaccine, then yes, herd immunity is something we should definitely go for by giving everyone the vaccine. That will definitely help, but until that time, you can go back and watch previous versions of this report, and you'll see that I mentioned that what you'll usually see is an increase in deaths, and especially among the elderly and those who have immune issues, because those are the ones that are going to die the most easily. And that is exactly what we're seeing in Sweden. Sweden is currently the ninth highest has the ninth highest COVID-related death rate in the world. And as predicted, many of those deaths are among the elderly. So, again, please don't think that we can rely on herd immunity. It won't happen until we have the vaccine. Or if it does, it means that we've gone a long time without the vaccine and we've sacrificed a lot of people that really didn't have to die. Researchers have also discovered that toilets and urinals can spread the virus that causes COVID-19 when they're flushed. The virus is excreted in urine and in our feces, and the flushing motion of toilets and urinals can actually spray that up into the air in droplets and aerosols. And they've actually found out that those droplets can infect other people. The droplets and aerosols can infect other people. So what they recommend is whenever you flush a toilet, make sure you close the lid first. If you happen to be using a urinal or a toilet that does not have a lid, such as many of those in public establishments, just make sure you're wearing a mask and stay as far away from them as you can while they flush. Also, really quick, washing hands afterwards should go without saying, but I'm going to say it anyways just to be sure we're clear. Wash your hands after you use the bathroom. So, despite all the bad news about COVID-19 that we've kind of talked about right now, we do have some good news. First off, Moderna, one of the companies creating a vaccine, says that early results from their vaccine tests among the elderly are very promising. The vaccine does seem to be working like it should, and it has very, very, very minor side effects. They have not seen any major side effects, anything that was concerning even to elderly people. Also, researchers have found that testing saliva for COVID-19 works just as well as sticking a swab deep into your nose. That'll make testing faster and, of course, more comfortable. We may not see this in testing locations very soon, though. It may take a little while just because all the equipment now is all focused on the deep swab testing. So it'll take a little while to get that converted over. Initial studies also show that some types of blood pressure medications, specifically ACE inhibitors and ARBs, can help reduce the severity of COVID-19 illnesses and reduce deaths. In other news, the Congo is experiencing a new Ebola outbreak. I guess technically it's not new, it's been going on for quite a while, but they had started to get it under control, but now much of the resources needed, money, focus, etc., needed for fighting Ebola has been redirected to COVID-19, and so that Ebola outbreak is starting to make a comeback. Africa is now considered free of wild polio. No new cases of wild polio have been seen for 4 years. There have still been a few cases of polio in Africa. In fact, right now they have a few cases in 16 countries in Africa, but those cases are not wild cases. They're not considered wild because they are caused by the vaccine. That can happen in places that are under-immunized. What they need to do is just continue the vaccinations, and once there's a higher level of people or higher amount of people that have the vaccines, you will no longer see the vaccine-derived polio cases. So here's hoping that that happens quickly. The recall for peaches that we mentioned last week has been expanded to include peaches found at more stores, not just Aldi like it started as. So please see the link below the video to see more details on that. A new study claims that caffeine in any amount is not safe for pregnant women. The current recommendation is to drink 2 cups or less of coffee per day if you're pregnant, or that also equates to less than 4 cans of caffeinated soft drinks. Low levels of caffeine can usually be handled pretty easily by adult livers, but babies do not have the necessary enzymes to break it down. Caffeine does cross into the placenta, and elevated levels of caffeine have been associated with miscarriages, low birth weights, preterm birth, childhood leukemia, and childhood obesity. The new study has been met with quite a bit of resistance, as expected in a country that is completely addicted to caffeine, as the United States is. Some scientists have called the study alarmist, but others have pointed out that caffeinated beverages don't really offer any nutrition, so why not just err on the safe side and get rid of them anyways while you're pregnant? Food for thought. I personally agree with that view that they don't offer nutrition, just don't use them while you're pregnant. So that's all our report for this week. Many weeks such as this one, more things happen than we have time to cover in just this report, but we have included more links below the video if you want to get more information on those other topics. Thank you for watching the Plain English Public Health Weekly Report for August 28th, 2020. I'm Richard Greenland, and you have a healthy weekend.